So let's take a look and see how the heart achieves this cardiac output. We will start by taking a look at what's inside, or just part of what's inside. We'll be looking at the four chambers, the four hollow cavities. We'll write right here, chambers. There are four of them. And we have a picture of the heart over to the left. Notice there are four chambers. We have one here, one here, one here, and one here. So if we divide the heart down the middle, and we have to keep in mind that this is the right side and this is the left side because we're looking at the patient's heart, not our own. So you can imagine that if this were taped to your chest pointing out, this is the orientation that we want to talk about. Okay, so we have two chambers on top and two on bottom. The two on top, each one is called an atrium. For the Latin entryway. Entryway. And it's a very fitting name because this is actually where the blood enters the heart, but we will talk about that more later. If we are talking about two atriums, we don't say atriums, we say atria, because again, it's a good Latin term, and this is the way the Latin language makes atrium plural. Atria, not atriums. Now the two chambers on the bottom are called the ventricles. Ventricles. We have a right ventricle and a left ventricle. And then above we would have a right atrium and a left atrium. And let's talk a bit about what their roles are. Again, we said that the atria are an entryway to the heart, and we can see like here and here, here and here, even here, right here, and then you can imagine that blood would come in right here. So you can see that these are hookups for blood vessels. So this is where the blood would enter the heart. We can't see at this picture where it would leave, and we'll get another picture of that. But the atria receive the blood. The blood is going to fall down into the ventricles through these structures, which are called valves. Valves. And we'll talk more about those. And then the blood, now down in the ventricles, would be pumped out either to the lungs or to the body. The right ventricle would send it to the lungs to get oxygen. And the left ventricle would send it, not in the direction of this arrow, but it would send it out to the body to drop off the oxygen, pick up the waste, bring it back, start the cycle again. Notice that the left ventricle, look at how big the muscle is here. This is the workhorse of the heart. It has lots of muscle around it, very strong contractions, and by comparison you can see that the right ventricle doesn't have a lot of muscle, but then it only has to pump the blood to the lungs, whereas the left ventricle has to pump the blood to your scalp, to your liver, to your toenail. It has to pump the blood everywhere. The atria, as you can see, are much smaller and muscularly, they're kind of wimpy. You can see they don't have a lot of muscle around here. But again, how far do they have to push blood? They only have to push it downstairs. It's a pretty easy job, I would think. So that ends our discussion of the chambers of the heart. And next we will talk about the valves.